Hello everyone, good morning. A lot has changed since we last met. I hope you're all safe and healthy. As you all know, the past few months have profoundly changed the way we lead our individual, professional, and social lives in a multitude of ways, establishing a completely new normal. However, we are lucky that we live in a part of the world that is well known for its resilience and ability to swiftly adapt and respond to changes. Underscoring this fact, once again, Dubai is bouncing back to normalcy rather quickly, thanks to timely and concerted efforts undertaken by our competent authorities under the guidance of our wise leadership. As a result, Dubai health tourism sector is now open to the world and stands ready to welcome back health tourists. The Dubai government's leading efforts to strictly implement precautionary measures to limit the spread of COVID-19, in coordination with national health authorities and its high-level engagement to assist infected patients in recovery, had put the Emirates' advanced healthcare sector once again in the global spotlight. It is against this backdrop that we have virtually gathered here today to be a part of this webinar, Dubai Leads the Great Comeback. We welcome the world back to this exceptional health experience and reaffirm our commitment to offering unparalleled health and wellness services in line with the highest standards and international best practices. Now let us watch a small video that reminds us of what makes Dubai so different from other health and wellness destinations. I hope you all enjoyed the video. I would like to introduce Dr. Marwan Al-Mulla, Chief Executive Officer of the Health Regulations Sector at the Dubai Health Authority, to deliver his keynote address. Dr. Marwan will let us know how Dubai and Dubai Health Experience DXH, the brand of health tourism for Dubai, is paving the way to the return of health tourism and wellness as an offering to the world. Welcome to the session, Dr. Marwan. We're all eager to listen to your keynote.
Hello, Linda. Thank you for the introduction. Hello, everyone. I hope you are all so safe and healthy. We all know that the world is currently navigating unprecedented crisis, a global pandemic that has made its impact felt on multitude of industries and sectors without any discrimination. Needless to say, health tourism is among the sector that were affected by this pandemic. However, thanks to the government's timely and concentrated effort and to deal with the repercussion of this crisis, we are now on the path to recovery. Dubai Health Experience remains committed to supporting Dubai in its journey to become the most preferred global health tourism destination and a hub for top accredited health facilities. A lot of changes had happened in the past few months, but thanks to timely and strategic measures adopted by the authorities to ensure patient safety upon health tourist arrival, Dubai still remains a destination of choice for health tourists even amidst the pandemic situation. The Emirates boosted its effort to attract health tourists post-COVID-19 by focusing on preventive and alternative practices. A lot of you know that Dubai has been, or the UAE has been very active in the dealing with COVID. We have did more than 4 million PCR COVID tests in UAE. Our recovery rate is more than 85%. And thanks God, our mortality rate is less than 0.6%. So Dubai Health Authority has played a pivotal role in facilitating the Emirates healthcare sector's response to its pandemic. Our frontline healthcare workers are more than 9,000 health professionals were committed day and night to support the patients on the journey to recover from COVID. We have more than 30 health facilities, private health facilities in Dubai. They were essential in the dealing with COVID-19 crisis. In Dubai alone, we did more than 950,000 PCR tests for all the residents and locals of Dubai. Moreover, we focused on active surveillance and we conducted more than 100 tests in Dubai for all the suspected cases. DHA established alternative channels to provide health services to patients during this period, including telemedicine services where we allowed our partners, our private health facilities to deliver the service without the bureaucracy of regulation. We allowed them to deliver medication to the patients, to give the teleservices to the patients, and be supported by the insurance coverage. We allowed free movement of health professionals among the facilities, and so that we all be part of combating the COVID-19 crisis. We remain, or during the first half of 2020, our number of health professionals have grown. We have more than 3,300 professionals we licensed during this period. 45 health facilities were also licensed. One more hospital during this period, and 10 general and specialized medical clinic we licensed during this period. So this shows that our commitment or our growth in the healthcare sector. If we talk about the health tourism, last year our numbers were around 350,000, where about 28% of these patients came from Arab countries and GCC, 17% of European countries, 34% from Asian countries, where the rest 10% from the Americans and the rest of the world. So these numbers we talked about, the 350,000 to 2019, it was a 4% increase comparing to 2018. The expenditure were more than 726 million dirhams in healthcare sector. And post-COVID, we are expecting to recover as fast as possible and pick up and complete the journey towards our goal of reaching more than 500 patients per year. Also in Dubai, we support traditional, complementary, and alternative medicine. We have more than 20 centers in Dubai where they provide these services, 8 specialties in the TCAM specialties, and around 234 health professionals specialized in healthcare and TCAM services. So our message today that we want to assure our stakeholders, our patients, that we are back. Dubai is open for business. Our tourism industry is back. Our health tourism industry is back. So even for the patients or population of UAE, they can consider Dubai with its facilities in the healthcare and wellness as a destination to recover from COVID and the stress after COVID, whether it's a wellness destination or a general checkup or a specific treatment. Most of our hospitals are internationally accredited. We have top experts from around the world. Our wellness destination is world-renowned. So, and our precautionary measures for COVID is coordinated with all the sectors, the hospitality sector, the healthcare sector, the aviation. So rest assured that Dubai is taking care of you. You will be in a safe hands in Dubai. All the precautionary measures for COVID are taken care of, and you are free to get the best of Dubai from in terms of wellness and healthcare services. So the second message also to our DXH group members that be ready. We are on the path of recovery. Expect more patients to come, and our numbers will pick up, and we will continue our journey towards our goal of 500,000 and beyond. The last message is to our agencies and planners. We are exactly 1 month away from a season where usually starts in September to welcome health tourists seeking your assistance and guidance to enjoy unparalleled health experience in the Emirate has to offer. So start planning the agenda today, and the DXH will always support you in efforts by linking with some of the world's best facilities. We are here along with our partners to bring you joy and happiness and health to wellness that unfortunately were put on pause during COVID crisis. But let us be ready to witness Dubai leading its great comeback. It's time for DXH to welcome the world back to its exceptional health experience. Thank you all for listening.
Thank you for the inspiring speech, Dr. Marwan, and we're looking forward to seeing Dubai welcoming back health tourists to enjoy an array of experiences. Now let me introduce Mr. Issam Kadhim, the Chief Executive Officer of the Dubai Corporation for Tourism and Commerce Marketing, to talk to us about Dubai tourism sector outlook for immediate future. And after Mr. Issam's speech, we will be joined by two key speakers, so please stay tuned. Welcome, Mr. Issam.
Assalamu alaikum and good morning, everyone. Thank you, Linda, for the kind introduction, and Dr. Marwan for the amazing stats that you have shared. First and foremost, I wanted to just start off by thanking you all for being here, thanking the DXH for this amazing opportunity and giving us a platform to speak with yourselves, and also to say that our heart goes out to those who were impacted by the pandemic. Obviously, we are very proud and very honored to be part of this city and this country who have put tireless efforts all the way from the leadership and the amazing partnership between the private and public sector to ensure that the public safety and security is the foremost paramount of importance to us. And of course, next thing being, how can we quickly open up and make sure that this health hygiene measures that have been put into place, along with the safety and security, to ensure that we can start welcoming tourists back into the city as soon as possible. So without further ado, I just wanted to take you through a few slides to show you what we have been up to in over the past few months since the lockdown, the work that we have been doing from a Dubai tourism perspective to ensure that we stay top of mind for the world. Here's just to show you quickly about our marketing approach. So what we've done as of late is looked at the May to June period, July to August period, and September, December period. And if you can see with the color-coded graphs here, that our measure was to stay top of mind, to ensure that people remember Dubai, think of Dubai, but at the same time to show them that we are in this together. It's a global pandemic. We're going through what they're going through as well. And you can see in the pink over there that this is a reassurance of safety, because it was something that was becoming very important for the people. At the same time, we kept a brand maintenance message showing them Dubai is quiet, but it's still Dubai and it's still here. July to August period, we started to focus a bit on the travel consideration side. We started to realize that people are starting to get a little antsy. They're getting a little anxious of staying at home within the four walls, and they're starting to search, to dream about the opportunity of them to travel again. So we started to send a bit of a travel consideration messages out there, doing soft campaigns, but again, making sure that we're maintaining the brand. But as you can see, the reassurance of safety started to become a bit more important. So we started to plug all the amazing effort that's been done by the health authorities here in Dubai, along with the senior leadership within the city and the country, to ensure those safety measures are being communicated globally, so people realize all the measures that are being put into place. And as we move closer and closer into the end of this period where we are in today and into the next one, which is the third phase, we're starting to look at the conversion aspect. Again, making sure that we are aligning with all our key stakeholders and partners to ensure that we can get them to Dubai soon. The Till We Meet Again campaign was the first part of that. We went out to 48 different markets with a simple message of serenity, quiet, till we meet again. It's a message of we miss you, but we need to stand together, stand tight. We need to stay safe during this period of time. And we achieved close to 20 million views and interactions with our audience. The next one talks about the promise, which is video 2. This time what we did was we focused a bit more on the markets that engaged with the first one. So it reduced to 21 markets that were actively anxious about Dubai, searching Dubai, interested in Dubai. So we made sure that this time we're talking about the promise of what's going to come, things for them to be looking forward to. And we achieved close to 15 million views on this one. Alongside this, what we've also done is we've started to engage with the people who have interacted with Dubai in the past, working with influencers, working with journalists, working with people who love Dubai as well. And we started to share with them, and we did a partnership leveraging our strong relationship with Google. We sent the Google VR boxes across to all of these individuals and started to share with them content that gives them a 360 perspective of a city that they've learned to love, something that they've been missing out on, to give them a chance to share their experiences within this 3D 360 experience with the world as well. Again, helping through their means and their channels to communicate Dubai even further. Alongside that, we also started to leverage the other partnerships that we've developed over the years. So partners such as Euronews, CNN, CNBC, we started to deep into the content that we have created with them in the past, making sure that the relevant content is repushed again to the audiences, plus sending out new information, new content about the city, all the new efforts that have been put into place, all the new measures that have been put into place, conducted interviews, making sure that, again, people are aware that Dubai is here, Dubai is safe, Dubai is secure, and they are ahead of the game and doing everything that it takes to ensure people's safety and security still remains paramount. What we also did was we leveraged a lot of the relationships that we've had with the journalists to make sure that we're sending out amazing stories about Dubai, some about the destination, things that people love to do, would love to do, and also looking at the efforts, as you can see the image there in the Australian-New Zealand clip with the heart, where we worked with the private sector, with the hotels, with other properties, who started to send out messages of compassion, of love to all of the people around the world working within the health sector, who are working tirelessly around the clock to ensure public safety and security stays important across the globe. What we also did was, in another influencer program, is we worked with, again, the influencers and journalists and other family members as well, locally and globally, sending out pieces of whether it's games or puzzles, whether it's the Dubai Monopoly or Lego, where families, since they are indoors, they can spend time to work together to entertain themselves and still have Dubai ever present within their experiences as well. Some of the other things that we've actually managed to do in the collaboration, leveraging a lot of residence programs, creating a lot of opportunities for retail. Again, every time you see that there is an issue or a problem that happens globally, there are new opportunities that come up and things that evolve beyond that, past the pandemic. And inshallah, once we find ourselves out of this, there are so many lessons that we've learned from this opportunity that will become the new norm as part of the normal practices for people going forward. Here are just some of the content pieces, throwbacks and reminiscing opportunities for the influencers, as well as content that was readily being created with the content pieces that we had sent across to these influencers as well. What we also did was, during this period of time, we brought Dubai to people's platforms. Since they couldn't come to Dubai, we took Dubai to them. So we worked with a partnership with the likes of Snapchat. And this has become by far the biggest thing Snapchat has ever done globally, and has now become a case study that they use across the globe, where we had Dubai as a backdrop that can be easily placed. And this gave people the opportunity to share their favorite spots and favorite points in Dubai with the globe. Again, engaging them, taking them out of their four walls, even though it's virtually, but at least gives them a chance to be a bit more playful, a bit more candid, a bit more tongue-in-cheek about the experiences, and created a great moment of experience and sharing amongst the people as well. All of this work that we have done during this lockdown period has actually helped move Dubai up across a lot of these channels. And if you can look at the consideration and top of mind, you can see in Dubai became the number one on the wish list of destinations between the March and April period of time on Booking.com, as well as Virtuoso. You can see it moved up into the top 5 as number 2 within Expedia, as well as other platforms as well. Leveraging all of that work that has been done in the past for us, this is just to give you a snapshot of the kind of dialogue that we've already established and reconnected again with the trade. Trade are also, of course, our partners on the ground within all of these markets, and the numbers represent the kind number of offices and number of partners that we have on ground over there that we are engaging with, to ensure that we can immediately start having packages, bundles, experiences that can immediately lead into a conversion. So really working down towards the bottom end of the funnel, so that interest turns into consideration and turns into a conversion, and eventually a visit into Dubai as soon as possible. Of course, all the efforts that have been put into place across the board by all of the different entities within the city working together hand in hand has given us this proud opportunity of getting the stamp of approval for safe travels by the World Travel and Tourism Council. And also alongside that, we have launched our own Dubai Assured program, which is us as Dubai Tourism, DED, as well as the Dubai municipality, ensuring that all of the technical measures are being put into place. And this is a stamp that is revisited every 15 days to ensure that, yes, you have to achieve the stamp to begin with, but also you need to make sure that you're putting all of those measures continuously in place, and it becomes their new norm to ensure that you sustain the Dubai Assured stamp of approval throughout the rest of the time as well. And this is just, again, giving you a quick overview of the international travel movement, something that we're keeping a track of in terms of how we ensure that we are opening up to more and more and more markets as soon as possible, but at the same time, ensuring that we're working well with our own health authorities here, the health authorities within those countries as well, to ensure that there are the right certifications in place before people arrive into Dubai, and also making it easier for people to be able to access tests, and also to ensure the safety and security of people arriving into Dubai, and more so the people who are within Dubai as well, that they can have a safe journey into the city and a safe visit and stay within the city as well. Thank you so much from my side. Linda, I guess I want to pass it back to you as well.
Thank you so much, Mr. Hassam, for sharing the Dubai tourism's view and the love message that's being spread by Dubai and the Dubai health to the world. We have embraced the world during the COVID crisis. We have been always open arms for the world. We are definitely a diverse community by all what this word means. We are proud to be what we are and what we offer for all the world in Dubai, in all aspects of life, whether it's tourism, health, or investment, or the lifestyle that Dubai offers. Really proud of all what everybody is doing here. I think the previous two speeches gave us a clear picture of what the outlook of Dubai tourism and the health tourism is for the coming times and after the reopening of Dubai. We're not done yet. We have now a panel discussion that will help us understand more about Dubai's comeback in health and tourism and evolving health landscape in terms of readiness and repositioning. Our panelists, our dear Mr. Sharif Bishara, Group Chief Executive Officer of the American Hospital. Welcome, Mr. Sharif. Dr. Tariq Fathi, Chief Operating Officer of MediClinic Middle East. Very welcome, Dr. Tariq. And obviously, we have our dear Mr. Isam Kadhim and Dr. Marwan, who will continue to be with us. Thank you very much, Sharif and Tariq, for joining us in this webinar. I will start the first question, and I'm going to direct it to Dr. Marwan. Dubai, Dr. Marwan, has become one of the leading cities that effectively dealt with this pandemic in terms of healthcare. How do you see this, and how can this be an advantage in easing the tourists' worries as they are thinking to come to Dubai?
Dubai has always been a dynamic city where we are able to deal with whatever challenges we have in partnership with our colleagues in the private sector. So this COVID pandemic showed us how great collaboration in the healthcare sector and the other sectors were essential to our success in dealing with COVID. So today we are very proud. More than 60% of COVID patients were dealt in the private sector. We opened new facilities and new venues to deal with all the patients from the mild or asymptomatic to the more severe patients. This was done in a total collaboration, government and private. And now we are ready with the decreasing in numbers to resume work. Dubai is open for business. Let's come to Dubai and restart the health tourism and enjoy the best of what Dubai can offer. So this is our message today, and we have our colleagues from the private sectors that they can share also their opinion during this period.
Thank you very much. My question may be to one of the representatives of the private sector, Mr. Sharif from the American Hospital. How can we still ensure patient safety of the health tourists as we'll be easing the health tourism and the health tourist journeys upon arrival? What's your perspective on that?
Thanks, Linda. Thanks, Dr. Marwan. First of all, let's highlight that any strong regime can be judged by the response to the pandemic. What Dubai has been done during the pandemic, what Dubai has shown to the whole world, that it's really has a very strong healthcare system. It's really have a very well organized and visionary and planned to that. It gives us and to everyone, and especially for medical tourism, how Dubai is safe and how Dubai is ready to accept any medical tourism at any time, which made our patients and the medical tourism patient more comfortable to come to Dubai. In Dubai or hospital, either it's private or government sector, they following the DHA guidelines. There are a few hospitals that they're following the international standard, and they're getting the maximum benefits out of their affiliation with the international hospitals and clinics all over the world. I'm not talking right now only American hospital. And you have Johns Hopkins here in Dubai. You have King's College. You have Mediclinic with their affiliation with one of the best in Switzerland. You have the affiliation of American Hospital with Mayo Clinic, which is #1 in the world. Why Mayo Clinic choose Dubai to have an affiliations? It's not only choosing of American Hospital. No, it's choosing of the system, choosing of the visions, choosing of the system and the regime, how it's stable and have a vision for the future for the medical tourism patient and how to get them more welcoming. We should learn from Dubai tourism. We should learn from Dubai overall how to welcome medical tourist patient at the end. He's a tourist. We should start welcoming him from his own country. How we start screening him, assign a relationship manager for each and every one of our international patients. There is a relationship manager and there is a medical coordinator. They welcome him at the Dubai airport, taking him to his room directly. There is no complicated process, doing his triage within the room. So that's the medical tourism right now. And the medical tourism, he's coming safe, secure, and with easiest process. And that's Dubai. Not about American hospital. I think all the healthcare system are ready for opening the city again and the whole country.
Absolutely right. I mean, even when Dubai Health Authority conceived the brand for health tourism, it was conceived with the term Dubai Health Experience, because we wanted to make sure that we go in tandem with what Dubai Tourism has been working on for all these years, and that is giving an experience next to none. And this brings me to Mr. Issam, as we've been talking so beautifully about Dubai Tourism. How can DTCM maybe collaborate further with the healthcare facilities to create those experiences that we all aim to provide for the health tourists?
Thank you, Linda. Thank you, Dr. Sharif, as well. I think from my side, it's key. I mean, at the end of the day, we've always referred to the tourists in Dubai. We never take them as a statistic and as a number, as visitors. We always talk to them about guests of Dubai as well. And I think that has, alhamdulillah, been part of our fabric, the way that we've been groomed ever since the beginning of time, that Dubai has always welcomed these different nationalities, and we have close to 200 different nationalities that have chosen Dubai to be home. And with that in mind, you have so many people who are regularly visiting Dubai with their families, or to visit families and at the same time visit the world-class facilities and take advantage of the world-class facilities that Dubai has to offer. I think for us, from our side, what we need to obviously continue to do more of is we've already conducted a lot of roadshows together. We've also made sure that we are working closely, hand in hand, in collaboration between us and the trade that we work with. Trade that I've kind of like shown a small glimpse of in one of my slides towards the end, which is people that can actually help us connect with these opportunities that are available in market, working with the local ecosystem to ensure that we have the right packages in place, not just about the individuals who will be visiting here on a wellness or a health visit, but also the family that's accompanying them as well, because we need to make sure that it becomes a well-rounded experience end to end. And we know from our experience from a leisure and business tourism side that, and especially as we've mentioned several points earlier today, when the city works together hand in hand, that collaboration, we know across every single touch point, from the airlines, whether it's Emirates or others that travel in, from the airports to the immigration, all the way into the facilities themselves, to the hotels, every experience can be so seamless. And I know for a fact, and I can confidently say, that we have everything on hand to make sure that Dubai becomes a must-visit destination for people who are looking for health and wellness, and also a repeat visit destination as well. It becomes a no-brainer that the minute they're thinking about where can they go that's safe, that's secure, that has all the world-class facilities and an experience for themselves and their families, Dubai becomes a no-brainer for them as well.
Absolutely. I mean, we know from many travelers who have come through the Dubai airport in the past few weeks that the experience, even with the COVID, has been next to none. So people arrive, everything is seamless. They get the testing done very smoothly. A mobile app sends you the result. You are taken care of. So the message is loud and clear, and we wanted to reach the whole world. Come and enjoy Dubai, and Dubai will take care of you. That's for sure. This takes me to Dr. Tariq. Dr. Tariq, in the past few months have changed many people's minds and thinking about so many different things. So if we take into perspective the specialities that we do think from your angle might still be attractive for health tourists to come to Dubai, what would they be, and where do you think we are in terms of our preparedness to receive those health tourists?
Assalamu alaikum and good morning, everyone. And I'd like to take this opportunity to thank you and my colleagues, Dr. Marwan, Mr. Isam, and Mr. Sharif, to be with you here today. Just over the last couple of months and during the pandemic, definitely everyone was busy, and I think Dubai actually set a role model of how to contain this pandemic, and that gives a very, very good infrastructure for us, and it was actually a very good proof to how strong and agile the healthcare system of Dubai. Now, over the last few weeks, we were actually busy analyzing what could be the patient needs for medical tourism. And if we look to the potential needs for the patients to start coming to Dubai for medical tourism, we can group them into the first category, which is wellness and preventative. And that definitely we can tap on the technology, the state-of-the-art genomics and precision medicine departments available now in Dubai. There are recently a few genomics lab and precision medicine where patients actually can easily understand their health needs and a personalized lifestyle and what they can do and can avoid to improve on their health needs. The next aspect or the next group of patients will be looking for enhancement, which is a cosmetics and plastic surgery. And definitely Dubai is very well known. There are very, very good established cosmetics centers, plastic, all advanced state-of-the-art. The latest technology is also available here. The third group of patients will be definitely looking at, and that we need to work closely with the travel agencies and Dubai Health Tourism, which is the holiday health. This is for patients who have chronic illnesses, like I'll give an example, the dialysis patients. We need to actually start planning for them before their trip about their sessions that can actually suit their leisure plans, and we can plan for them a package which include actually their dialysis sessions. And the last but not least group of patients who will be actually looking for the tertiary care services, which Dubai, as my colleagues referred to, is very well known now. A lot of international players, Mediclinic is one of them, American Hospital with their affiliation in Mayo Clinic, and many others have presence here, providing a wide spread of tertiary care, subspecialty, starting from open heart surgery to cancer treatment, to vascular surgery, organ transplant, robotic surgery. So Dubai actually managed to build a very, very strong healthcare system. And I think we have so many areas that we can really attract medical tourism to Dubai.
Wonderful, Dr. Saleh. That's very reassuring that Dubai is definitely out there and ready. This takes me maybe for a question to Dr. Marwan. In the current situation, from your angle, how do you see that we can all collaborate to make Dubai the destination of choice for health tourism? I know the world is looking for safety. This is now the language that everybody speaks. They want to travel because everybody needs to travel, and even they need it more than before to recuperate. So how can we all, in terms of the different parts of the business, the health and the tourism, how can we make this happen?
Yes, Linda, this is an excellent question. Dubai assures safety from the beginning, starting from the airport to the hotels, to the hospitals or the wellness centers. So like Mr. Assam mentioned, DTCM, they assure the safety of the hotels, and they regularly check that the hotels are fulfilling the standard for COVID precautions. And also from our side, DHA, we are also working with our hospitals and private partners to ensure that all the precautionary measures for the safety for the patient are taken care of. Even if you take to the malls, also our malls with the safe social distancing and wearing the masks, we all as a community, we participate actively to assure that the comprehensive control of COVID patients and COVID pandemic that's reflecting in our numbers. Thanks God, the numbers of cases in Dubai decreased dramatically. While we see in other countries, maybe it's not under control, but in Dubai, it's under control and beyond. It is decreasing, and hopefully we will reach to the level that we can go back to business. And with the advances in healthcare, we are hearing a very good news regarding the success of immunization trials. And in fact, one immunization trial is happening in Dubai, in UAE, I mean. So, and other countries also that are conducting the same. So life should go on. We assure the patients and the visitors to Dubai as whole that Dubai is taking care of you. We are taking all the necessary measures to assure your safety, and we are interested in your wellness and your health and your happiness also. And we are looking forward to repeated visits to Dubai and a successful wellness and health treatment in Dubai.
Thank you, Dr. Marwan. Dr. Tariq, how do you see second medical? Dr. Tariq, second medical opinion has proven to be a very successful program that Dubai Health Experience started a few months ago. How do you see this contributing to the return of health tourism for Dubai?
I think second medical opinion is now more accessible and more available, definitely through the international affiliations. Many of the healthcare providers here have established, like what I mentioned, Mediclinic have an affiliation with Hirsch London Group in Switzerland. American Hospital have affiliation with Mayo Clinic for second opinion. And thanks for Dubai technology infrastructure, which makes things much easier now through telemedicine, that the patient actually can have the consultation with the doctor anywhere in the world, and definitely within the healthcare system itself, through our healthcare professionals, that can be organized and that can be done. So there will be a proper continuity of care, that we can obtain a second opinion, and the patient will get the treatment physically here in Dubai with our colleagues. So I think the access to international players is definitely adding value and will help us to attract more patients through the medical tourism.
Dr. Marwan, in the past few months, we know that telemedicine had been a very successful tool. Can you tell us about the journey, please, that telemedicine had taken with COVID and before COVID?
Yes, telemedicine services was already active in Dubai before COVID. In fact, last year, DHA embarked on a journey and a project to activate Doctor for Every Citizen, where it is one of the initiatives of Sheikh Mohammed bin Rashid to provide telemedicine services for all its local patients. And we worked with our partners, the private sector. We enabled this service. We made changes in regulation to allow tele-prescription of medications and delivery of medication. So it's just by coincidence, when COVID happened, we were already launched Doctor for Every Citizen in December 2019. And we expanded the patient base to allow all the nationalities to avail of this service. We understand that there was patients were encouraged to stay at home. If it was not an emergency case, to stay at home, use or utilize the telemedicine service, and the medication will reach you. And also from the health regulation side, we allowed this service to happen in the private sector. In fact, we told them you can start these services before applying even. So at that time, we had to utilize an agile approach of regulation, where we support our partner, the private sector. We enable them to treat the patients remotely, and so that the hospitals themselves, they cater for COVID patients. So that was an excellent experience. And after COVID, we need to continue this momentum. So all these changes, all these benefits that we happened, it will be continued and it will be allowed, because during this time it proved its success and safety for the patients.
Absolutely. I think one of the biggest worries that we had on our mind as regulators during the COVID is the safety of the patients and the continuity of care for those who are non-COVID, but they still need the access to healthcare. And thankfully, with all the forward thinking that our leadership had through the years, we have reaped the benefit of it during the COVID crisis, and we were able to quickly bounce up and rebound very quickly without any dips, and it was a very smooth sail. So we used all those ready infrastructures in terms of technology and thinking, and I think that is what Dubai was very unique in. This forward thinking and positivity and the collaboration between the private and the government sector. If I want to ask Mr. Sharif here, was I being heard? Yeah, I think so. Mr. Sharif, being a group CEO and also you are into the investment side, do you feel that you feel safe to invest further in healthcare in Dubai? And would that be something that you think the health sector will be looking into expanding in the coming times?
See, Linda, when you think about the investment, you have to figure out first what's the status of the country. What's the status of the regime? What's the stability of the economic? When you see a country that 12 to 15% of its budget, it's assigned for technology and innovation, it gives you as an investor as a sign. When Sheikh Hamdan bin Mohammed bin His Highness announced in 2014 DXH, and how he and the leader and the whole country interest and concentrate on the medical tourism and grow the future of this, that reflects a vision. When you think as an investor, you should make sure that there is a vision for the country, there is a proper structure and proper strategy, then you will start investing on the areas to complete that vision. And we at Muhammad and Ubaid al-Mawla and American Hospital, we believe in the country, we believe in our leader. That's why before the COVID, for example, we invest millions of dollars at the robotic surgery, and we brought one of the finest technology in robotic surgery in the world. And at that time, we were the only robotic surgery program within UAE, operating on Da Vinci XI. And that was great, because within a couple of months, and when the pandemic attacked the healthcare, we succeed to operate on 115 or 110 patients, extremely complicated, with zero complications, with zero infections, which has helped us a lot on the investment in technology. When you see that His Highness Sheikh Mohammed bin Rashid in 2018 and asking that, guys, the AI and technology should be everywhere and in each sector in Dubai. And when the pandemic attacked us, we figure out very, very, very nothing from my perspective as a resident. Dubai hasn't stopped. Dubai is not reopened. Dubai hasn't stopped. All the activities is continue. All the government activities continue. Nothing is stopped. Why? Because it's well prepared. So if you want to think as an investor, always focus on the vision of the leaders of the territory. When you have the leader of Dubai, you can invest blindly, especially in healthcare, because there is a very clear vision for the government in healthcare. And last point that I want to raise it, that's what pushes us to put a huge investment to set up the first artificial intelligence research lab within the region that's based in Dubai. It's not based in American Hospital. That's our contribution as a Mohammed and Ubaid al-Mullah Group and the American hospitals for the country. Yes, we done it, we invested, but all the hospitals without exceptions, all the government hospitals without exceptions, were more than welcome to utilize that tool to go for the next phase or the next era. Thank you. I hope I'm clear.
Very clear. Dr. Tariq, from your angle, I mean, in the past few months, we saw how strong the health professionals' knowledge and experience that we had was really sufficient for us to be strong and to be able to weather the crisis and be strong. Do you see that visiting doctors programs can enhance the expertise that we have? Do you think that that needs to be something that we need to work further on to encourage health tourism? What's your perspective on that?
I think if we look backward, Linda, many years ago, there was quite a big scope for visiting doctors, perhaps to add and help Dubai to establish the certain gaps in the system. However, over years, Dubai Health Authority have managed actually to develop a strategy. They managed to invest a lot in technology, in infrastructure, develop a very, very agile and international regulations, which created a lot of trust for world-renowned doctors. And through the healthcare system and the whole Dubai as a lifestyle, Dubai as a community, it attracts a lot of doctors now that it's not anymore a visiting. This is a place where I would like actually to live. One of the things which a lot of the world-renowned doctors actually were missing here in Dubai was two components. One is research, the second one is academia. And if we see over the last 10 years, this one was a big focus of Dubai government, research and academia. Mohammed bin Rashid University is established now in Dubai and got a very good reputation, and a lot of world-renowned doctors coming from all over the world now to move to continue their academic activities as well as their clinical practice. And when it comes to research get a lot of funds, a lot of support. It's one of actually the key strategy for Dubai government now. So more and more, there is a lot of world-renowned doctors, a lot of skills has been added to the healthcare system. And as I mentioned before, that was proven during the pandemic. We have, like Dr. Marwan mentioned, we have one of the lowest mortality rate in the world. We actually managed to rebound back in a very short time. Like what Mr. Sharif said, Dubai actually never closed down. If you see, actually everyone was normally, and so the only thing is everything was serviced to you at home, either through apps or through websites, but everything was available, all the services. We saw some other healthcare systems actually how much they suffered. But in Dubai, the healthcare system was actually very, very strong, and they coped with the surge very well. So I think there might be a scope in certain areas for visiting doctors, but I think this is going to be limited more and more through actually the attraction. And a lot of more and more doctors actually now would like to relocate to Dubai. And I have no doubt that in the near future, Dubai will be actually exporting clinical experience to the other countries around us as a visiting doctors from Dubai.
Thank you so much, Dr. Tariq. Mr. Assam, from the perspective of DTCM, what do you see next? And how do you see the future? And how do you see health tourism being weaved in the offerings of Dubai for tourism and for attraction?
I mean, when it comes to the health tourism side, I think my esteemed colleagues here have been very detailed about it. From our perspective, what I can say is, I know for a fact that going forward, as part of the new norm, more and more people are definitely looking at the health and the measures far more strictly now when they decide on the next destination that they're going to travel to. And I think the measures that the teams have been taking locally is going to really put Dubai right up there with the rankings. We've always had a ambitious target for ourselves, following the message of Sheikh Mohammed that impossible does not exist in our dictionary or in our lexicon, and we truly believe in that. And I think as Dubai is a city, private public sector, we truly believe in that. And going towards what Dr. Tariq has said, Dr. Marwan, and also Mr. Sharif highlighted very clearly, this is why people have that trust when they come to investing in Dubai, to moving to Dubai, and also visiting Dubai. So for us, of course, it's making sure that that message continuously goes out. And I think what Dubai did during the pandemic has really all of a sudden triggered to those who were unaware that, wait a second, Dubai has this world-class standard, these facilities that we probably were not aware of. And now they will make sure that this becomes part of that journey as well. We have, alhamdulillah, seen growth in tourism numbers for Dubai. When we set out a target for ourselves back in 2013, we had 10 million visitors. And even during the challenging time of 2018, 2019, we saw growth that has taken us up and maintaining our number 4 position of the most visited city globally. And again, for Dubai to have that number compared to all of these well-established, globally renowned tourism destinations is something we're very, very proud of. And I can tell you for certain that we are sure 100% that even when it comes to the healthcare side of things and the health and wellness tourism side of things, Dubai has already established an amazing, amazing foundation for itself. And it's all about building on that foundation now to see bigger and bigger growth for that, inshallah.
Inshallah. I will ask the same question to Dr. Marwan. How do you see the near future for health tourism in Dubai?
Yes, as Mr. Assam said, health will be an important factor for all tourists. So for choosing their next destination, whether their primary focus is being a tourist or the health, they will look at each country, what's the infrastructure in terms of healthcare, if they are coming specifically for treatment. So Dubai has already established itself and assured the patient also for the period after COVID. So this is one factor that will attract patients to Dubai and normal tourists also to Dubai. The second thing also, we will build on the adopting technologies and advances in technologies. We have, as Mr. Sharif mentioned, we have robotic surgeries, we have telemedicine. So all these advances, Dubai has the infrastructure to support it in terms of regulation, in terms of telecommunication. So everything is open, and we are here. We have a very flexible regulation that allow innovation in healthcare. We have also 3D printing in healthcare. So all these will attract more patients and more even health professionals, surgeons, to choose Dubai as a destination. If they want to do like a visiting surgery, visiting doctors program, they will also use Dubai as a destination and to add it to their portfolio, so to cover more patients around the world. So Dubai, within the infrastructure and geographical location, we are in reach of billions of population, and they can all reach us with our infrastructure, with our airport. And as Mr. Sharif said, we have not closed, but we are repicking, and next year, inshallah, we will be having Expo also. So we are expecting more patients and more visitors to Dubai, and we welcome all and wish all the best for everyone.
I just want to, Linda, if you don't mind, I just wanted to add to what Dr. Marwan just said. And what we always talk about is Dubai and its geographical location is within a 3 to 4 hour radius of 1/3 of the world's population. And within an 8-hour flight radius, we're within 2/3 of the world's population. So that just shows you the potential that Dubai has. You're absolutely right.
I think Dubai has embraced that very well and taken the lead in welcoming everyone and embracing everyone in Dubai. If I can ask the private sector to tell us their perspective on what they think the future will hold for health tourism, maybe I can ask Dr. Tariq to start commenting.
Yeah, I think from a private sector and specifically from Mediclinic, you mentioned about investment, and we definitely focus and we invest in more. We trust the Dubai system. Mediclinic has been here for years, and the good thing about Dubai is that every challenge is an opportunity of a new success, and that's something which we really enjoy being here in Dubai. And it's enough to say, I mean, my colleague Sharif mentioned about robotic. During actually the pandemic, we have launched our robotic surgery also program. We successfully managed to recruit one of the trainers in robotic surgery as well. So we trust the system, and we believe in actually Dubai is going to be greater than what it was before, even in healthcare tourism. We hopefully in 1st of September, we will launch a precision medicine department and a big genomics lab with the latest and state-of-the-art technology. That will definitely support, as I mentioned, because this is a big scope now in wellness and preventative healthcare needs. So we believe that Dubai is going to be stronger. I think now we are ready for the next spike and we believe actually that this is not going to be too far. And we are ready for it, and we look forward to support the government vision in this strategy.
Absolutely. I mean, the past few months have been a witness of all what you have said. And we have all of us in different meetings on different levels, discussing what to do and working hand in hand, shoulders to shoulder to weather the crisis. And really, it was amazing to see how much Dubai can offer to its people and its visitors. And that's what's really unique about this gorgeous city. Mr. Sharif, can I get your perspective? Sure.
That's great. First of all, I love the picture of Dr. Marwan and Assam next to each other, because once the healthcare sector and the DTCM working closely together, I believe that will not be stronger. Dubai already strong, but we can be the destination of the healthcare and the medical tourism within the world. When Mr. Assam saying that third of the world is 3-4 hours and the majority is 7-8 hours, guys, I believe we can compete with the whole world. Right now, we have the latest American standard within Dubai. We have the latest British standard within Dubai in healthcare. And there are many other countries, without naming, they cannot access those countries. They can easily come to us with their families, getting the healthcare treatment, their family enjoying the Dubai and the whole Emirates with much easier procedure and much easier accessibility. Dubai, my dream to Dubai, we have a great static and great dermatology and cosmetics and all of these programs. But I'm dreaming to Dubai to be the destination for the heart transplant within the region and for the whole world. I'm dreaming to have the best cancer center. That's why American Hospital take the responsibility. By mid of next year, we're introducing the first smart and comprehensive oncology center, 90% operating by AI and technology. That's not for us, that's for Dubai. That's our payback to Dubai. All the healthcare sector, all the private sector, we got the benefits of Dubai, we got the benefit of Emirates Airline, we got benefit of that. It's time to pay back. So I believe that cardiology, cancer treatments, and before the treatments, how to utilize the technologies for the diagnosis, before the diagnosis, how to get the Dubai, the destination to predict for the disease and to stop spreading and treat the people. That's all about technology. We cannot be part of Dubai, and we cannot be way ahead from all over the world in technology. If you want to see really the standard of healthcare in Dubai, and all of us are traveling abroad, going to Europe, going to America, all my respect to all countries, and see our hospitals and our standard without exception. I'm not talking American hospital, forget American hospital now. Mediclinic, King's College, Kilimanjaro, Latifa Hospital, one of the hospitals that which is government. No one knows that they have one of the top laparoscopic gynecologists, surgeon within the whole world. It's top 4. People are coming from all over the world to this guy to get the treatment at the government hospital in Dubai. So right now we should stop talking about government, private. We are a healthcare sector. We should build the future of the medical tourism within Dubai and think big. Transplant center, that should be our goals. Kidney transplant, liver transplant, heart transplant. We have all. And that's bring us to, if I might disagree a little bit with Dr. Tariq, at the beginning, no, you need the visiting doctors to come, the professors from all over the world, to start the service within Dubai hospitals, train our surgeon and physician for a while, then depend on ourselves. And that's the history of Dubai. In the past, we brought the consultants, they train people. Right now, when we say Emiratization, see on each single area, you have the top talents from UE nationals. So we need a visiting doctor for a while. Then we can say easily, we are the most prepared city on the world to take over the destination of the medical tourism. And I'm sure will continue. I have no doubt to evolve the welcome of medical tourism during difficult time more than simple time. Thanks.
That was beautifully said, Sharif, really beautiful. I mean, I don't want to make it longer for any of you. It was a very, very insightful discussion and quite an interesting session. I thank all our panelists again for joining and drawing us a clearer picture of the recovery in terms of health tourism. I would like to thank all those who have helped us to make this session come into life, and thank all those who are following us and watching us now. The message is loud and clear. We continue to work hard to attract more health and wellness tourists to our beautiful Emirates by spreading awareness about the wide range of world-class services and facilities that are available throughout Dubai. We are confident by all means that Dubai is the ideal location to spend a post-COVID wellness sojourn. So join us in Dubai soon, and thank you everyone.